Good evening and welcome to tonight's regional news. We begin with a story from Brazil. Brazil's President Jair Bolsonaro said that the federal government will not buy the COVID-19 vaccine from China's Sinovac, one day after the health minister said it would be included in the nation's immunization program. On Tuesday, Health Minister Eduardo Pazuello said in a meeting with state governors that the ministry would buy the Sinovac vaccine to be included in the immunization program, along with the AstraZeneca Oxford vaccine. That inclusion would be contingent on approval by drug regulator Anvisa, he said. But Bolsonaro said that Pazuello had been misinterpreted during the meeting with Brazil's governors. I quote, "For sure, we will not buy the Chinese vaccine," end of quote, Bolsonaro said on social media, responding to a supporter who urged him not to buy the vaccine. Then on Wednesday, the health ministry announced that Pazuello has tested positive for the virus, making him the latest Brazilian official to do so. Bolsonaro tested positive earlier this year. Sao Paulo's State Biomedical Research Center, the Butantan Institute, is testing the Sinovac vaccine, and Governor João Doria said that 46 million doses of vaccine would be made available even if it's not included in the federal immunization program. I quote, "The vaccine is what is going to save us all. It's not ideology, it's not politics, it's not an election that will save us," end of quote, said Sao Paulo's Governor Doria, who is viewed as a potential presidential candidate for the 2022 elections in Brazil. On Wednesday, a volunteer who was involved in the clinical trial of the AstraZeneca vaccine died. Turning now to Trinidad and Tobago. Scrap the exams and pay the pupils' query fees. These were among the calls of parents and pupils who protested outside the Red House, which houses the parliament in Port of Spain, Trinidad, to show their dissatisfaction with the grades of the 2020 CSEC and CAPE exams given by the Caribbean Examination Council, CXC. Both parents and students carried placards bearing messages such as "Justice for CAPE," "Be responsible, CXC," "Teachers' grades matters," and "Give us back our predicted grades." Parents and students had protested earlier in the week outside the Red House over the same issue. On Sunday, CXC Registrar Dr. Wayne Wesley confirmed that the examination body would address within the week thousands of grade queries that were received from pupils across the region. He also said CXC will reduce the fees associated with the request for reviews by 50%. At a virtual meeting on Monday, education ministers from several Caribbean countries unanimously proposed that a total waiver of fees for reviews of grades by CXC should be considered. And finally, news from Haiti. 10 years after a cholera epidemic swept through Haiti and killed nearly 10,000 people, families of victims still struggle financially and await compensation from the United Nations as many continue to drink water from and bathe in a river that became ground zero for the waterborne disease. Cholera was introduced into Haiti's largest river in October 2010 by sewage from a nearby base of UN peacekeepers from Nepal. 6 years later, the UN acknowledged it played a role in the epidemic and had not done enough to help fight cholera in Haiti, but the organization has not specifically said it introduced the disease. The disease spread quickly in a country that just 9 months before the epidemic began had been devastated by the January 2010 earthquake. Former UN Assistant Secretary General Andrew Gilmore called it an avoidable tragedy that may rank as the single greatest example of hypocrisy in our 75-year history. 850,000 people were infected in a country of 11 million that had not reported a single cholera outbreak for more than a century. The last confirmed case in Haiti was reported in January 2019, but the epidemic's aftermath is still felt across much of the country. One of the biggest concerns a decade after the epidemic began is the ongoing lack of funds to help those affected. The Office of the Special Envoy for Haiti said that more than $705 million was spent to fight cholera, including more than $80 million mobilized by the UN agencies since 2016. I quote, "Despite the gains made to stop transmission, much more work remains to be done to support them, as well as the hardest hit communities," end of quote, the UN said in a statement on Wednesday. That was all for tonight's regional news. Thank you for joining. Back to you, Wendell.